So in this question, there is a midline neck swelling just below the hyoid bone and managed by the cyst trunks operation leads to post-operative need for thyroxine replacement. So the most likely diagnosis is, so the clinical clues are, we have a midline swelling, midline neck swelling. It is just below the thyroid, below hyoid, and is managed by the cyst trunks operation, and post-op hypothyroidism occur. Hypothyroidism leading to thyroxine replacement. So the answer will be thyroglossal cyst with only functioning thyroid tissue. So we will see it one by one. So it means that there was no thyroid gland, no normal thyroid gland was present, and the ectopic thyroid tissue was present in thyroglossal tract, which was excised. So the thyroglossal cyst was having the only ectopic thyroid tissue, and that was excised. So what is the thyroglossal cyst? So first of all, what is the thyroglossal cyst? So thyroglossal cyst is, let's see one by one. Thyroglossal cyst. So it is the persistent thyroglossal duct. Now what is thyroglossal duct? So the thyroid develops at foramen cecum at base of tongue, and then descends to neck through thyroglossal duct. Generally it obliterates, but if it fails to obliterate, it leads to cyst formation, which is known as thyroglossal cyst. Now there are some classical features. What is the classical features? That it is below hyoid bone, which is given in the option, that is below hyoid bone. And number 2, it moves both with swallowing and tongue protrusion, while the thyroid gland will only move with swallowing and not with tongue protrusion. Why? Because the only thyroglossal cyst is attached with the foramen cecum via the tract. Now another thing is that what is cyst trunks operation? What all are removed in the cyst trunks operation? So it is the standard treatment for removing the thyroglossal cyst, in which there will be excision of cyst, entire thyroglossal duct, and central portion of hyoid bone, so that there will be reduction in the recurrence rate. Why sometimes the thyroid replacement is needed? Because sometimes the thyroglossal cyst can have ectopic thyroid tissue, and so as to avoid it, we must do investigations first, so as to find out that normal thyroid is present or not. So that's why the answer will be the D option, the thyroglossal cyst with only functioning thyroid tissue. Now going to other options. First, the lateral evident thyroid. Lateral evident thyroid present as lateral neck mass, not as midline neck mass. Lateral neck mass. What is it? It is metastatic lymph node from papillary carcinoma of thyroid. So papillary thyroid carcinoma. From the papillary thyroid carcinoma, the metastasis goes to lymph node, and that presents as a lateral aberrant thyroid, and it is not treated by cyst trunk. So no cyst trunk operation occurs in lateral aberrant thyroid. So first option is wrong. B option is only thyroglossus cyst. So if it would not be having a normal thyroid tissue, then the thyroxine replacement would not have needed. So only thyroglossus cyst will not be option, so it is wrong. Now solitary thyroid nodule, in that case it is located in the thyroid gland and it is not below hyoid, not just below hyoid bone, number one, and it is not treated by cyst trunk surgery. So the option which is correct is D, the thyroglossal cyst with functioning thyroid tissue, and the thyroglossal cyst is treated with the cyst trunk operation. So this is the correct option.